So thousands of us are having to wait at least a week for a doctor's appointment. And then when you do manage to get one, there's just the 10-minute recommended time slot. This isn't only stressful for patients, but it's also putting GPs under enormous pressure as well.
Big time. An exclusive investigation by Good Morning Britain and Pulse magazine has found that nearly half of GPs are saying now that the stress of their job is affecting their patient care, with some doctors turning to alcohol and prescription drugs to cope. Katie Rickett has more.
Long waiting times, short appointments. It's stressing us out, but GPs are worrying themselves sick. Our exclusive survey with Pulse magazine found that almost a quarter of GPs think they'll be off with stress over the next 12 months.
Currently, at the age of 38, I'm dealing with having very high blood pressure. I'm now on medication for it, unfortunately. When I'm off work, my blood pressure actually becomes quite low. But as soon as I go back to work, that increases and I have to have more medication.
15% are turning to alcohol or prescription drugs to manage their stress, something many find difficult to admit.
At the worst period, I was probably drinking up to a bottle of wine a night. I just felt tired all the time, hungover. Sometimes I fall asleep at practice meetings and stuff, and more depressed.
What would happen if you went back to full-time work, do you think?
I don't think I could ever do full-time. That would be dangerous for my health, I'm sure of that.
Perhaps most worryingly, 45% of GPs told us they believe their stress or burnout has affected patient care.
I had 87 prescriptions that I needed to assess. I felt utterly overwhelmed, so I processed them without having done all the checks that I might normally do.
Many doctors told us they're considering leaving the profession, which would add even more pressure to a system already struggling to cope. Katie Rickett, Good Morning Britain.